My name is Ann Rhodes. I'm a registered dietitian. Today we're going to be discussing problem behaviors often encountered with a client who has dementia when you're trying to feed them. We'll also be discussing interventions that might be useful in counteracting these problems. Clients with dementia are at high risk for poor nutrition and for weight loss. They can be quite difficult to feed or to encourage to eat. Some recent research has shown that people with Alzheimer's disease actually need more calories than people of the same age. However, due to their disease processes, they often forget to eat, don't realize they're hungry, have trouble using utensils, are resistant to being fed, can't sit still long enough to complete an entire meal, or may not remember how to chew or swallow. As caregivers, we want to keep our clients as independent as possible, and yet we also need to ensure that they are eating. We also need to remember to treat our clients with memory losses with respect and dignity, and to speak to them as they are adults. It's often easy to talk to a client as if they're a 2-year-old because they're acting like a 2-year-old, but we have to remember that they are adults. Join us in the dining room while we observe a caregiver serving some clients. Watch the first of each scenario where the caregiver ignores the problem behavior or actually contributes to it. Then the second scene where he will be intervening appropriately. The first scene will be showing distractions. Often a client with dementia will be distracted by other people, by playing with non-food items or food items. Noise can be a distraction, or if they're given too many choices. In this first scene, see if you can pick out some of the problems.
Hi, Mr. Jones. Mr. Jones, we had some beverages today. What would you like? We have some coffee, soda, milk, tea. What would you like? What would you like?
I get coffee.
Coffee? You don't have to have coffee. We have milk.
Now watch the caregiver interact more appropriately. He might move a client to a quieter area, or not place two clients next to each other so they can't be touching each other. Remove items that are distracting. A client with dementia doesn't need an attractive centerpiece on the table. Have quiet music. Use soft voices in the dining room. And limit choices. Don't ask them numerous questions. Give them 1 or 2 choices.
Yeah, you can get to talk to me, that's right.
Hi, Mrs. Smith. How are you today?
I'm just fine.
Good. Hi, Mr. Jones. How are you today?
Hi.
What you got there? What are you playing with?
I got this.
Can I see what you... I see it?
You can, all right, you can.
All right, thanks.
You can have it.
Oh, would you like something to drink today? We usually have coffee.
I have a coffee, please. Give me that. I have a coffee, please. Give me the coffee.
Okay.
Give me some coffee.
The next problem behavior can be inappropriate actions. A client may be jumping up and down from the table or banging on the table. They might be mixing their foods together, or eating non-edible food items. Frequently, a client with dementia will hide foods. They'll either put it in their pocket or put it in a purse. They might be eating non-finger foods with their fingers. Some clients will only drink their liquids or only eat one food item or smear the food item all over their face. See what the caregiver is doing in this first scenario.
My phone. I don't want my phone. I want my food. I want my food. Where's my food?
Here you go, Mr. Jones.
Oh.
Settle down now. You got your food. Here you go.
Oh.
You can sit down now.
Oh.
Jeez.
Okay, I'll sit down now.
Here's your food now.
Oh, that's
In that scene, the caregiver was not very effective, was he? Just kind of ignored the situation. A better way to handle things would be if you have a client who is impatient, banging on the table, constantly getting up, try to feed them first. Give them their food immediately. Again, if a client is eating non-edible items or playing with things, remove those items from the table. If they're hiding food, ask to hold that food for them. If they're not willing for you to do that, don't force them to, but then possibly remember later on to get that food back from them when they go back to their rooms. If a client is having trouble using proper utensils, help them, guide them, cut their food up for them. Cue, say, oh, Mr. Jones, you might want to use your fork, or let me put this in your right hand. For mixing food together, offer one food item at a time. This frequently works with patients who are confused. They can know what to do with one food item. If they get 3 or 4, they get confused. Now watch where the caregiver is using some interventions to get the mealtime to go more smoothly.
Where's my food? Where is my food? Where is my
Hey, Mr.
food?
Jones. I brought your food first, since you're so hungry.
Very good. Very good. Oh, yeah. Oh,
Here you go.
Oh, hey.
I'll be right back with your food, Mrs.
Oh.
Smith.
Okay, but, you have them here, see?
Here you go, Mrs. Smith. How are you today?
Just fine, thanks.
Good. Here, Mr. Jones, let me help you with that.
Oh, okay, okay, yeah.
Here.
Okay,
Here you go.
uh,
Let's cut this up a little bit for you. There you go.
that's right, that's, I'm glad to have.
What do you got there, Mrs. Jones? Can I see? Can I hold that for a little bit? Thanks. So how are you today?
I'm just fine.
Good. Did you try your meal yet?
A third problem behavior with a confused client may be that they just sit and don't know what to do with the food, or they may refuse to open their mouth. Often you'll see someone just staring. They don't even know how to initiate the mealtime. Or a client may be falling asleep at the mealtime. They may actually put their head into their plate. You'll be seeing a scene now where the caregiver is not very effective in any of these manners. Watch and think about what you would do differently if you were the caregiver.
Mrs. Smith! Wake up, Mrs. Smith! Come on! Come on, wake up. It's time to eat. Why aren't you eating? Come on. These are really good. Come on, eat it. Why don't you want to eat it? Just take a bite. Come on. Come on. Fine. Guess you're not going to want to eat today.
The caregiver was not very patient, was he? He certainly didn't spend any time trying to get this client to eat. Some things that you might do that are more effective, first thing would be to wake your client gently if they are asleep. Treat them as a person. talk to them, let them know it's mealtime. When you do try to get them to eat, you might need to cue them, which means say, pick your fork up, pick your spoon up. Now bring the spoon up to your mouth. You might even need to be saying, now chew your food. Sometimes you'll need to assist with what's called a hand-on-hand technique. And that is actually taking your hand, placing it over the client's hand, holding the spoon, putting the spoon into the food, and then bringing it up. Sometimes you'll do that 2 or 3 times, and then the client will be able to continue doing it themselves. Sometimes you'll have to do that the entire meal. That's still better than actually feeding the client themselves, because it is getting them to use their own muscles. If a client's clamping their mouth shut and seeming to not want to eat, there are several techniques that can be used. You can just say, open your mouth now, and see if that works. If not, you might stroke their cheek or stroke under their chin, and they might open their mouth that way. Never grab their mouth and force it open. Just gently stroke their cheek, and it might work. If that doesn't work, you might need to bring the spoon up to your client's lip. Frequently, once the spoon hits their lip, their mouth will open. If that doesn't work, if they've absolutely clamped their mouth shut, you are not going to force them to eat. But you might continue trying, or wait a few minutes and then come back and try those same techniques. Now sit back and watch and see if the caregiver does a better job this time.
Oh, Mrs. Smith. Mrs. Smith, wake up. Hi. Want to eat now? Here. Aw, come on. How was your visit from your daughter today? Was that good? Did she enjoy the stay? There you go. Those are good mashed potatoes. Here's another bite. Here, you can try it now. I'm gonna help you. Hold on to it. Just bring it up to your mouth. Open your mouth. There you go. You got it. Here you go.
And the last problem that we'll be discussing is when a client has difficulty feeding themselves or inability to feed themselves. And this happens as the dementia progresses. Often a client might have trouble using their utensils. They might not remember how to use them, or they're unaware that they're even there. Another thing clients might do is just pick up an entire piece of meat or an entire roll and stick it in their mouth and try to chew. And this can be caused by a couple of things. One, if they've unsuccessfully been able to cut their food, they may just give up and say, I'll just eat it. Or not being aware of their utensils at all, they might just, well, this is how I eat. That could have been a very unsafe situation with the client putting the entire piece of meat in his mouth and trying to chew it. If the caregiver was not observant, the client could have been choking. Some techniques to use when a client's having difficulty in using utensils would be to just offer a spoon. Most foods can be eaten with a spoon, and if they only have one choice, they'll be able to use it. If a client is actually having physical difficulty holding the utensils, or if for some reason they can't bend their wrist or anything like that, you may need to get the occupational therapy department involved. The occupational therapists can provide what's called adaptive equipment. Sometimes they'll put tubes on the utensils, or a utensil might be bent so they don't have to bend their wrists. They have all sorts of equipment and techniques to have a client be able to feed themselves. That will be discussed a little further in another tape, but it's important to know that with trouble with utensils, there are ways around that to keep the client self-feeding. Again, if a client just cannot use a utensil or a cup, you may need to feed them. But prior to feeding, you should again try the hand-over-hand technique. Sometimes that is enough to get the client to feed themselves. You can do that with the utensils, as we explained before, or with a cup. You can actually physically place your client's hands on the cup. You put your hands over and bring the cup up to their mouth. Anytime you can get the client to be using their own muscles, it's much better, and it might just trigger their mind to, oh yes, this is what I'm supposed to be doing. Another thing that's very important is you need to be cutting up your client's food and making sure that they're safe. That way, if they pick a piece of food up and put it in their mouth, it won't be a large piece of meat, it would just be a tiny piece. As the caregiver, you need to be observing as much as possible to keep things safe, to keep your client able to feed themselves if possible, but if they're not able to feed themselves, that you're there to help them. Now watch and see what the caregiver does in this situation.
Hi, Mr. Jones. What are you doing there? I see you're having troubles cutting your meat. Here, let me help you. Let me help you. Here you go. I'll show you. Here. Here you go. There. Now you can take little bites.
Now we're going to discuss the caregiver's responsibilities in mealtime preparation for the dementia patient. Again, we've gone over this in the past, but it's worth repeating. You need to start with washing your hands. Tell the client that it's mealtime and what's being served. You probably will need to say not just that it's mealtime, but it's lunchtime, Mrs. Jones. And today we are having green beans, mashed potatoes, and roast chicken. And you might want to intersperse something like, doesn't that sound good? Or aren't you hungry? You need to try to get the client in the mood for eating. Then wash their hands, brush their teeth, take them to the bathroom. If they say they don't want to go, you may want to take them anyway, because frequently a client with dementia is not going to know. Make sure that their clothes are dry and that they're appropriately dressed. You would not want to be sitting in wet clothing while you're eating. So make sure that theirs are dry. Have the client seated in an upright position to prevent aspiration. Make sure that their chair back is straight. Place a clothes protector on them. Let them know what you're doing, and don't call it a bib. Using the word bib is kind of demeaning to them. And what you can say is, Mrs. Jones, could I put this clothes protector on you to keep your clothes clean? If a client does not want something going over their head, you can put it across their chest, but you do want to keep them covered up, because chances are they will be spilling. Make sure that they're going to receive the correct tray, and you do this by looking at the tray card and the client's name tag. With the dementia client, it's probably not best to rely on asking them what their name is, because many people will agree to whatever you say. If you say, are you Mrs. Jones? They'll say yes. Are you Mrs. Smith? They'll say yes to that also. So you really do need to be looking at their name band until you definitely know who they are. Make sure that they're receiving the proper diet. It's your responsibility to know what foods is appropriate for which diet. Your client is not going to be able to say to you, oh, I'm on a low-salt diet, I shouldn't have that sausage. You're going to need to do that yourself. Take the food off the tray and place it in front of the client. And you do this because it's more home-like. At home, you would not be sitting with a tray at the table. That looks more like fast food. We want to keep our settings as home-like as possible. Cut foods into bite-sized pieces. And make sure that everything is easily eaten. You'll need to butter the bread. You'll need to open all cartons, open wrappers. Assume that your clients can't do that. Season the foods to enhance the flavor. For people who would be able to answer, you could ask, would you like your eggs salted and peppered? If they can't, or you don't know what they like, you can either ask another caregiver that might know that person more familiarly, or season it just slightly. Season it as maybe you would want it done. Make sure that all the items are within a client's reach, so that they can reach their glass of milk, that they can reach their cup of coffee. Some clients will find too many things confusing, and they may need to have one item at a time. Might need to have only their mashed potatoes on the plate, or only their green beans. If they're getting 2 or 3 beverages, they get one at a time. During the mealtime, once you've set the client's trays up, if you are not assigned to feed a specific client, you'll need to be monitoring the dining room. And what this means is you'll walk around the different tables, and if you see clients who aren't eating, you can cue them, encourage them to eat. If someone's not eating, ask why they're not eating. Do they not like the food? Do they want something different? Maybe they need help getting started, and once they get started, they can finish eating themselves. Encourage socialization. That might stimulate someone's appetite. You could get your clients talking about the food. Don't distract them by talking about a football game or talking about something else, but keep it food focused and food or related. As the patient gets more demented as the process is going along, they may not be able to participate in conversation. They may need to focus solely on the task at hand, which is eating. And often people might need to be at a table where there's only 1 or 2 people at the table because anyone else around them is distracting them. We want to keep the dining room environment quiet and calm. Don't want to have loud music playing. If there's a TV in the dining room, it's probably not appropriate to have it on. Want to keep things very calm. Feeding clients. You want to try to allow the client to feed themselves as much as possible. So if you know that someone can handle a piece of bread, you might start with the bread and let them hold the bread themselves. Let them know what they're eating. Often with dementia, they might look at the food, but it doesn't quite process. So you need to let them know. You might remind them again, this is lunchtime, and you're having a bowl of soup. Try verbally cueing your clients. Mrs. Jones, pick your spoon up, put it into the carrots, bring it up to your mouth. That might be enough to get someone started eating. Or you might need to remind them to keep eating, or gently wake them up if they're falling asleep, or if they're getting distracted and looking away, bring them back to the plate. If you're going to be actually physically feeding someone, you need to be sitting and being at their level. And that's for 2 reasons. One, if you're standing above them and feeding, the spoon is coming in at the wrong angle and it would be easier for them to aspirate. The other is if you're towering over them, you're not sitting and communicating with them. And you need to be sitting and talking to them. Don't rush. You need to feed the client at their own pace. It might take them a very long time to chew a bite. If they're prone to holding food in their mouth, you need to be aware of that. Very important with dementia clients to give them 1 or 2 bites of food at the most and then give them a sip of something to drink. And that should help if they do have any residual food. That will help bring it back down. Feed food separately. Don't mix them together. You wouldn't want to eat your green beans mixed with your ice cream. You want to keep the food separate. Sometimes with a dementia client, mixing foods together may be the only way to get them to eat. That would be indicated on their patient care plan, and that would only be used in specific situations. Typically, you would not mix their foods together. You might need to remind your client to chew and to swallow. Sometimes people will get the food in their mouth and they won't remember it's in their mouth, or they can't remember what to do with it. Sometimes if someone's having trouble swallowing and it's due to their dementia that they're forgetting to eat, that it's not due to a physical swallowing problem, rubbing their neck like this will stimulate the swallow. And again, you do it very gently. And you would say, now swallow, Mrs. Jones, while you're doing that. You need to be observing for any difficulty in swallowing. Clients with dementia are at a much greater risk for choking on foods and fluids than other people. And that's partly because they're not consistent in what they're doing. While our swallowing mechanisms are somewhat automated, we don't have to think about it. As a client is getting more and more dementia, their abilities to swallow are declining. Watch for pouching or pocketing of food. That's where they get the food, they might chew it up, and you might think they've swallowed it. But if their cheek is getting bigger and bigger, like that, they're not swallowing it, they're pocketing it. If after feeding someone their voice gets gurgly or kind of watery sounding, or they cough after they eat or drink, that is an indication that they're swallowing wrong. And that would be a situation where you'd want to let the nurse know. You need to report and record how much a client has eaten when you're done eating, and report to the nurse any unusual behavior or information. Sometimes a client who normally eats well suddenly seems to have forgotten how to eat. And that can happen with a dementia client. Then you need to let the nurse know that. Report to your supervisor any change in appetite, intake, if someone is vomiting, if they're having difficulty eating, if they're complaining of nausea. Anything out of the ordinary needs to be reported to your supervisor. If a client ate poorly at that meal, let your supervisor know. They might need to have a snack offered to them that afternoon. Frequently, if someone doesn't eat well at that meal, they'll take something an hour or 2 later. You need to be aware of which of your clients are receiving diabetic or other special diets. Those people in particular, the nurse will need to know how much they've eaten. Also, most facilities will have a record of how much every client eats, especially of the clients with dementia, because they aren't able to tell. They're frequently not even able to say they're hungry between meals. So those people have food intakes and input and output records, and you'll need to follow those according to the policy of your facility. Feeding clients meal times is a big portion of your day, and there's a lot of steps involved, but it can be a very fun and rewarding time also. It's a time where you sit and get to interact with your clients. You're not rushing around doing things, but you get to sit and treat them as people, and I hope you enjoy feeding your clients as you continue on your training.